Sarah, a student nurse, stood confidently beside her mentor, Nurse Thompson, as they entered the hospital room of an elderly patient. Mrs. Johnson, Nurse Thompson handed Sarah a clipboard with the patient's chart and said, "Okay, Sarah, please take Mrs. Johnson's vital signs. I'll observe and ask you questions as you go along." Sarah nodded and began by introducing herself to Mrs. Johnson and explaining the procedure. "Good morning, Mrs. Johnson. My name is Sarah, and I'm a student nurse. I'm here to take your vital signs today. This will help us monitor your health and make sure you're doing well." Mrs. Johnson smiled weakly and nodded. Sarah continued, "I'll be taking your temperature, pulse, blood pressure, respiratory rate, and oxygen saturation. This will only take a few minutes, and it's a routine part of your care." As Sarah took Mrs. Johnson's temperature, Nurse Thompson asked, "Sarah, what's the normal range for body temperature?" Sarah replied, "The normal range is between 97.7 degrees Fahrenheit and 99.5 degrees Fahrenheit, 36.5 degrees Celsius to 37.5 degrees Celsius. We use a digital thermometer to ensure accurate readings." Nurse Thompson smiled, impressed. "That's correct. Digital thermometers are more accurate than oral thermometers and reduce the risk of cross-contamination. Now, what type of thermometer are you using and why?" Sarah held up the digital thermometer. "I'm using a digital thermometer, which provides quick and accurate readings. It's also easy to use and less invasive for the patient. We can use it to take temperatures orally, rectally, or axillary, depending on the patient's needs and preferences." As Sarah moved on to take Mrs. Johnson's pulse, Nurse Thompson asked, "What's the normal range for pulse rate in adults?" Sarah responded, "The normal range is between 60 and 100 beats per minute BPM. We can assess the pulse rate manually by feeling the radial pulse or using an electronic device." Nurse Thompson nodded. "That's right. Manual pulse assessment is an important skill for nurses to develop. Now, what's the correct technique for taking blood pressure?" Sarah demonstrated the proper technique, wrapping the cuff around Mrs. Johnson's arm and inflating it to the correct pressure. "I'm using the Korotkov sounds to determine the systolic and diastolic pressures. The cuff should be at heart level, and the patient should be seated comfortably with their feet on the floor." Nurse Thompson observed as Sarah took Mrs. Johnson's blood pressure. "Good job, Sarah. You're using the correct technique. What's the importance of accurate blood pressure measurement?" Sarah replied, "Accurate blood pressure measurement is crucial for diagnosing and managing hypertension, which is a major risk factor for cardiovascular disease. It also helps us monitor the effectiveness of antihypertensive medications and make adjustments to treatment plans as needed." Respiratory rate and oxygen saturation. As Sarah continued with the procedure, Nurse Thompson asked her to explain the normal range for respiratory rate and how to accurately count breaths. Sarah replied, "The normal range is between 12 and 20 breaths per minute. I'm counting the breaths for a full minute to ensure accuracy. It's essential to observe the patient's breathing pattern, including the depth and rhythm of breaths." Nurse Thompson nodded. "That's correct. Accurate respiratory rate assessment is vital for detecting respiratory problems, such as respiratory failure or respiratory infection." Now, what's the importance of oxygen saturation levels? Sarah responded, "Oxygen saturation levels indicate the percentage of hemoglobin saturated with oxygen. A normal range is between 95% and 100%. This helps us assess the patient's oxygenation status and identify potential respiratory problems. We can use pulse oximetry to measure oxygen saturation levels, non-invasively and continuously." A job well done. As Sarah finished documenting the vital signs, Nurse Thompson beamed with pride. "Excellent job, Sarah. You demonstrated confidence and competence in taking vital signs. Your knowledge and critical thinking skills are impressive. You're on your way to becoming a skilled nurse." Sarah smiled, feeling proud of herself. "Thank you, Nurse Thompson. I'm glad I could demonstrate my skills and knowledge. I appreciate your guidance and feedback throughout this exercise." Nurse Thompson patted Sarah on the back. "You're welcome, Sarah. Keep up the great work. Remember, practice makes perfect." So keep practicing those vital sign skills. You got this.